sick, step in, hold them up, fit in a wedge, whatever you need to do. All right, Patrick, Fiona, are we good to go from your perspectives? Good to go? All right, everybody ready? Let's light this candle, yeah? All right. I'm Adam Rubin. I'm the Director of Economic Security Project Action. Thank you all for joining us here today. H.R. 1, the partisan budget bill passed over the summer, is rocket fuel for America's affordability crisis. Millions of people across this country are already struggling with skyrocketing prices for groceries, for electricity, for housing, and now healthcare costs are crushing families. Trump and Republicans have slashed Medicaid and the Affordable Care Act, sending premiums through the roof. Instead of offering them relief, this partisan bill will slam over 22 million Americans with outrageous, hugely expensive new healthcare premium hikes. 22 million people will see their healthcare costs nearly double this fall as a result of this bill. And over the next few years, 15 million people will lose their health insurance. This means fewer families can afford health insurance, all to pay for massive new tax cuts for billionaires. It's a betrayal of hardworking Americans. We need affordable health care, better quality, lower costs, life-saving drugs accessible to everyone. The good news is that Congress has a chance to make things right now. Representative Adam Gray has led the introduction of a bill to protect health care and lower costs for all Americans, because we need more health care. We need better health care, not less health care, and certainly not to pay for tax cuts for billionaires. And the folks across this country can't afford another sky-high bill. So we're here today to call for bipartisan unity to defend health care and bring prices down for working families across this country. I'm happy to introduce Representative Adam Gray of California to talk about this plan. Thanks very much.
Good morning, and thank you all for being here today. Thank you to our guests who have joined us to share their experiences. I look forward to hearing from them here shortly. Thank you to our friends at the Economic Security Project for their work today as well. Nearly 71 million Americans rely on Medicaid for their health care coverage, and they are facing cuts to their care and increases in their monthly premiums. Employers are already anticipating that they will have to raise the cost of health benefits for their employees next year. Prices are too high already. And the budget bill that the president signed into law isn't helping matters at all. I want to be clear on this. These cuts and these price hikes are a direct result of the Republican majority's choice to pass a strictly partisan budget bill. These cuts mean longer wait times at the emergency room, higher costs for treatment, longer drives to the doctor's office. In rural communities like mine, where more than half of my constituents rely on Medicaid for their health coverage, we will face clinic and hospital closures, increases in monthly premiums, and working families will be forced to go without care. The Protecting Health Care and Lowering Costs Act would reverse the Medicaid cuts and extend the Affordable Care Act's premium tax credits to prevent a spike in health care costs and protect health care for all Americans. Next to housing, health care can be the next largest line item in a family's monthly budget. It's essential that we bring this legislation to a vote immediately to protect access to care for millions of working families. I urge my colleagues on both sides of the aisle to join me in supporting this legislation and showing the American people we're serious about lowering their health care costs and protecting their coverage. Up next, I'd like to introduce an incredible leader within our caucus, a fellow Californian, Chairman Aguilar.
Good morning, everyone. I want to thank Congressman Adam Gray and the Economic Security Project for hosting our event today, and the brave individuals behind me here who will share their stories about their experiences with healthcare in our country. As you know, earlier this summer, Donald Trump led Republicans in passing the Big Ugly Law. This administration's signature achievement gives tax cuts to billionaires like Elon Musk and Jeff Bezos by taking food away from hungry children and ripping health care from people who need it most. Republicans know how unpopular and cruel this legislation is. They've spent the last week attempting and failing to rebrand this bill as something centered on workers instead of the elites that it truly represents. But the American people are too smart for that. They know that the big ugly law is making our country, our economy, and our society weaker. Democrats know that it's too late, that it isn't too late to protect Americans' health care, and that's what this effort is about. We just need a handful of Republicans to join us in undoing the damage that they've inflicted, and that starts with legislation like the Protecting Health Care and Lowering Costs Act. This bill would reverse the cuts to Medicaid in the big ugly law and permanently extend the ACA premium tax credits that have been a lifeline to so many families like those in my district. Right now, nearly 400,000 people in my district depend on Medicaid or receive a premium subsidy. Unlike Donald Trump and Republicans, Democrats are laser focused on making life more affordable for hardworking families so they can succeed, not just get by. I look forward to working with each of you in order to get this done. Thank you so much for being here, and thank you, Adam, for your leadership.
Thanks very much.
Thank you.
Next, I'd like to bring up Representative Frank Pallone of New Jersey.
Thank you. Thank you, and let me thank Adam Gray and all the sponsors here and the various groups that are supporting his bill. The Republicans have created a health care crisis with their big, ugly bill. I don't know how anything could be more cruel to the average American than what they've done in cutting Medicaid, in refusing to extend the ACA tax credits. I mean, I'm back in New Jersey, and the filings that have already had to be in place for the insurance companies for our marketplace have already been made in August. And the media has been drawing attention to the fact that for many people who maybe now are paying only $100 a month for their marketplace ACA coverage, may end up paying $300 or $400 a month and will not be able to afford it, and therefore will go without health insurance. And the same is true for the Medicaid cuts. We're seeing hospitals close, we're seeing community health centers close, particularly in the rural areas of the country. So this idea that this may not happen right away, this is happening now. The crisis is now, and you're seeing this as we speak. So all we're saying in this legislation is end this health care crisis. Get rid of these Medicaid cuts that were in the big ugly bill. Address the ACA tax credits that need to be put back in place. I would make them permanent, which is what this bill actually does. And I have to tell you right now, I know all the discussion is about the spending bill and what's going to happen by the end of the month. I'm not voting for any spending bill that does not address this healthcare crisis in a serious way. We owe it to the American people to address this. It's an affordability issue. The biggest problem that people tell me about affordability is the inability to pay for healthcare costs because they keep rising. And this bill is the answer. Let's get it passed. Thank you again. Now I'm supposed to introduce, I believe. Oh, you're doing it? Okay. All right, thanks
so much. Now I'd like to introduce Philippa Pham Hughes, who is a writer and artist here in D.C. who's experiencing a significant rise in her health care costs.
In 2013, I was diagnosed with breast cancer, and that year-long treatment would have cost $150,000. I paid $3,000, and that's because I had health insurance. I'm a freelance artist and writer, so I pay for my health. I've always paid for my health insurance out of pocket. I don't work for a company, and I still don't work for a company that pays for it for me. And, you know, I've always thought it was necessary to keep paying these premiums. It has given me the options that have allowed me to make life-saving decisions. I remember paying about $300 or $400 a month at that time, and that seemed like a pretty high amount of money to be paying out of pocket, but it felt like the responsible thing to do. Having healthcare insurance meant that I could have regular checkups, the kind of checkups that would allow me to detect this disease early, which is why I'm here to be able to talk to you today. It has meant also regular follow-up care, which means that I can stay cancer-free. But as you know, the affordable, since then, the premium for my health care has gone up substantially, significantly every year. So right now, my annual, my monthly premium is $1,100 a month. But because of the tax credit, I pay $723. It's pretty high, but I think it's a necessary thing to ensure my health, to ensure my ongoing health. But last month, I got this email from the DC Health Insurance Marketplace, and it said that the tax credit is ending this year. And that means that I'm going to be paying double what I pay now. That means that 1/5 of my income is going to be going toward health insurance. And I simply do not know how I'm going to be able to afford paying 1/5 of my income to that. Having health care has always been a priority for me. It meant early detection, especially of a disease that is curable with early detection. It's meant that I haven't had to make, decisions foregoing treatment that I might not have been able to afford. And it means that I don't lose my home because of medical bills. So I'm expecting my health insurance to double next year, starting in January. And I just don't know what to do right at this point. I'm not going to be able to afford health insurance that once saved my life. I'm pretty outraged. I'm mad that Republicans have voted to drive up the cost of health care, all in service to give tax cuts to their billionaire buddies. Everything costs too much. Everything keeps going up in cost every single day. And Trump and his administration and the Republicans in Congress aren't doing anything about that. They're not doing anything to help average Americans like me. In fact, they're actually making things worse. So I'm calling on Congress to please help Americans like me have affordable health care going forward. And I thank our Congress people here today for doing that. Thank you.
Thank you very much, Philippa. I'd like to bring up Representative Gabe Vasquez of New Mexico. Thanks very much for being here.
Thank you. Buenas tardes. Thank you all for being here. My name is Gabe Vasquez. I represent very proudly the 2nd District in New Mexico, Southern New Mexico. And I'm proud to stand here today with my fellow Democrats in supporting the Protecting Healthcare and Lowering Costs Act. Thank you so much, Representative Gray, for introducing this pivotal piece of legislation that Americans need right now. Now, I co-sponsored this bill because so many folks in my home state of New Mexico need to see these Medicaid cuts reversed. And they know that these devastating Republican cuts to health care is literally a matter of life and death. And that includes my rural communities, and that includes my tribal communities in my district. And right now, due to cuts in this Republican tax bill, 38,000 people in New Mexico's 2nd District are at risk of losing their Medicaid coverage. The harm that's inflicted by these Republican cuts isn't just going to be limited to Medicaid. If the ACA enhanced premium tax credit expires under our watch, under Republicans' watch, insurance premiums are going to double for thousands more across the state who have private health insurance. That means that for over 50,000 New Mexicans, most of whom are already struggling to make ends meet, that's an average increase of $500 per month for health care costs. Now, in my district and in my state, $500 a month goes a long way. 50,000 people is a lot of people. Those aren't abstract statistics. Those are our neighbors, our friends, our family that are facing the real threat of losing access to the care that they rely on every day. And for them, losing coverage means going without life-saving medicine and care, skipping critical checkups, delaying treatment when it matters the most. That's not a choice that any American should ever have to make. Now, I've heard the fear in New Mexico firsthand. In June, I visited Socorro General Hospital, which serves rural communities across my district in New Mexico. And the staff and the medical director there spoke about the dangers of taking health care away and the repercussions that they would have to public safety and community health. And they especially highlighted the danger to expectant mothers in our state and our district. In New Mexico, over 50% of births are covered by Medicaid. Just last month, I also went to Carlsbad Medical Center in the heart of oil and gas country, one of the wealthiest places in the nation. And I heard from hospital leadership there about the harsh financial reality that they are facing. That folks who are relying on Medicaid are going to lose access to their health care. That they will no longer be able to afford preventative care that can prevent medical emergencies. And these are folks who are out every day on the oil fields, in the oil rigs, working to produce America's energy. This is about protecting families, keeping our rural hospitals open, ensuring that no one has to choose between their health and putting food on the table. And so let me make this clear. As insurance premiums go up, the entire healthcare system in this country feels the impact. Those are our tribal communities, our rural communities, our private ratepayers. This is going to have a domino effect that's going to ripple across this country. With this bill, we can reverse these harmful cuts to Medicaid, permanently extend the ACA tax credits, and prevent this preventable tragedy to the American people. Thank you, Mr. Gray, for introducing this bill. I'm proud to support it.
Thank you, Congressman Vasquez. Pleased to introduce Representative Angie Craig of Minnesota.
Thank you so much, and thank you to Congressman Gray for introducing this legislation. You know, I usually start an address like this by saying, it's great to be here, it's great to see you. But the unfortunate truth is that we shouldn't even have to be here